Each year, a life-threatening medical condition causes hundreds of thousands of deaths in the United States, and it can happen to anyone with an infection.
Sepsis is the body's extreme and overactive response to an illness or wound. If not treated early enough, sepsis can lead to widespread inflammation, which can cause tissue damage, organ failure, or death. Doctors say fast diagnosis in emergency departments remains a challenge due to several factors, including vague symptoms, which overlap with other conditions.
But a rapid diagnostic test developed in Baton Rouge, Louisiana, has been described by some as a game changer. In March of 2022, Chris Davenport's day started like any other. As she prepared to pick up her grandchildren, Chris says she was overcome by sharp stomach pain.
I had to cringe to comfort myself, and it came every 5 minutes nonstop.
Chris went to the emergency room where doctors diagnosed her with an intestinal issue. A few hours after giving her medication to ease her symptoms, they sent her home.
I do remember the doctor in the hospital giving me something for pain and nausea, and it stopped.
But the next day, the pains came back, and she returned to the emergency department. Only this time, doctors diagnosed her with sepsis.
Did you know what sepsis was prior to what happened to you?
I did, but not the way I know about it now.
When someone is septic, the immune system overreacts. Instead of just fighting off the infection, the body's defenses start attacking its own organs and tissues. But here's the tricky part. The doctors we spoke to say sepsis symptoms are often mistaken for common infections. We're talking pain, fever, rapid heart rate, and less common signs like confusion, shortness of breath, and clammy or sweaty skin.
One of the problems with sepsis is that sepsis looks like a lot of things, and a lot of things look like sepsis.
Dr. Bud O'Neill is the medical director at Our Lady of the Lake Regional Medical Center in Baton Rouge. He did not treat Chris, but Dr. O'Neill and a team of scientists developed a test to help doctors identify the deadly condition. It's called IntelliSep. Their work began on the project in 2014.
Over the years, we kind of developed that technology, developed the clinical science behind it.
In December 2022, the technology cleared a major hurdle when the U.S. Food and Drug Administration approved it for use in hospitals. 8 months after winning FDA approval, the Our Lady of the Lake Health System administered its first test.
What ends up happening for us is a patient shows up into the emergency department. We screen them to see if they're at high risk.
Dr. Christopher Thomas worked with researchers throughout this project and designed the implementation of the test.
So where does this specimen go in here?
So this is the module in which they insert the actual specimen from the patient, and then where they do their work is right here.
IntelliSep uses a blood sample to squish white blood cells to see how they react. Healthy cells typically bounce back, while septic cells stretch or flatten out as a result.
What this machine specifically is looking at is your personalized white cells.
In under 10 minutes, results determine if the patient falls into one of 3 risk bands. If the test shows a high probability of sepsis, then
We want our teams to say, go get that patient, start the treatment, assume it's sepsis.
We're going to work on that toss and then time the release. There you go.
As for Chris, she did not receive the test, but it was not fully available at the time of her infection. She spent over a month in a medically induced coma, and doctors amputated both her feet and hands. Following months of recovery, Chris says her goal now is to raise awareness. For his part, Dr. O'Neill hopes IntelliSep becomes part of the standard of care in hospitals because he says it's proven to save lives.
Every week, there is one patient who goes home to their family that would not have otherwise gone home without this technology.
IntelliSep is primarily available within the Franciscan Missionaries of Our Lady Health System in Louisiana and Mississippi. It's also part of a pilot program at a hospital in Wisconsin.
The National Institutes of Health says without insurance, the cost of IntelliSep is more than $3,800, but the survival rate of patients who receive the test is 95%.